Well, Mark, we knew prior to the holidays, prior to Christmas, that they had seen a significant increase in the number of flu cases over east, and this is early, for the flu season. So that in itself was kind of a red flag that we were seeing it early, and it really started to increase in significant numbers. So we watched it very closely here throughout the Christmas season and the Christmas holiday and New Year's, and sure enough, during that time period, especially closer to the New Year's, we started seeing significant numbers of flu cases. We've seen 75 here so far to date, and there were, as of yesterday, another 11 that we were treating in the emergency department and looking for placement here in the hospital in inpatient units. So this morning, we kind of got together, called the command staff together here at the hospital. We involved county emergency management, and as you know, we do the PODS program here in the county, our medical countermeasures, got those folks involved, and we looked at several things. Number one, knowing that we were seeing a significant number of folks in the emergency department, how could we assist those people, let's say triaging themselves, if you will, by going to an urgent care rather than the emergency department. So we knew public notification was important, and we want to get a message out to the general public that basically says if you have flu-like symptoms and you're not critically ill, you may want to consider going to your family physician or to urgent care in Blairsville or urgent care here at IRMC. The second piece of that was prevention. Obviously, how can you prevent passing the flu around, washing your hands, coughing in your sleeve, all of those normal preventative measures. The third piece of that was we wanted to try as quickly as possible make available flu shots to as many folks in the county as we could free of charge. One of the problems is last year the flu was almost non-existent, and I think what happened this year, a lot of people just ignored it. They didn't get a flu shot. That's not helping the situation in terms of the volumes that we're seeing. So we're actually going to open up 3 pod locations on Saturday morning from 10 to 2 p.m. In the southern part of the county. We're going to do Blairsville at Chestnut Ridge, which is our urgent care facility down there. Ed Smith, our pod manager, is going to coordinate that for us in the south. Here in Indiana, we're going to open up one at the outpatient services building, which is where our urgent care is at. Kelly Pigeon, our pod manager for Indiana, is coordinating that one. And in Marion Center, we're going to open up a pods utilizing the hospital's mobile van at the Dr. Park's facility up there in Marion Center. So we will, we will make available flu shots from 10 to 2 p.m., and then we're going to watch our census here tomorrow and through the weekend and see how that goes and make some provisions internally here in the hospital to be able to manage it. We literally have put ourselves in what we call a modified code green or a modified disaster situation, which allows us to do some things differently than what we would normally do on a day-to-day basis. So there are requirements that prohibit us from, let's say, opening up a unit under normal circumstances where if we're in a disaster mode, we can do that. So we're in the process of looking at that, looking at it from the standpoint of staffing, equipment, supplies that would be needed, and so forth, so that if in the event things really get bad, we're able to manage it. One of the important things to point out is that kind of everybody's in the same boat. So when we call around other hospitals, we can't be diverting patients to other facilities with flu symptoms or ill from flu itself because they're full too. So we have to look at taking care of our own and ensure that we can manage the number of patients that we're going to see as a result of the flu.
Dan, you mentioned census. What is the current situation regarding the census, or I guess I can put that in terms for listeners, the number of beds that you have available in the hospital itself, let alone the ER?
Yeah, normally, like today is a good example. Our census was, I think, 127. We can manage up to say 140 patients inpatient. So we're looking at, and potentially more, and that's what we're looking at. We're looking at trying to maximizing the number of beds that we have available for those patients.
Anything else, Dan, that you'd like to add? Well, we hope to have a couple of guests on our radio shows to even get in more detail in the morning.
Right. I think the significant thing here is not to cause, unnecessary anxiety about the flu. This is not a catastrophe or a disaster. We're not at we're not at a critical stage, but we are at a serious stage. We're at a point where this is an epidemic, and it needs to be dealt with appropriately, and people need to take it seriously. So, there's a lot of questions about, well, should I get a flu shot? Shouldn't I? People have strong feelings about it one way or the other. They need to consider it, do some research, and seriously consider getting the flu shot because it does work.
Danny, would our listeners be able to access even more detailed information, either on the hospital website, emergency management website, that type of thing, or even the Facebook page?
Yeah, absolutely, Mark. There's multiple ways. Locally, we have the hospital's Facebook page. They can go on that site. They can also go on the Health and Human Services subcommittee site. All they have to do is Google in HHSS subcommittee, Indiana County HHSS subcommittee, and that'll come up for them. The other thing they can do is go on the Department of Health website, and there's good information on there also. Specific to Indiana County, you want to stay with the local connections. In other words, the hospital site or the HHS site will give them the information about what's happening locally, the pod information, local information regarding hospital status, and so forth.
And we will also have links on our 4 Renda broadcasting websites right here in Indiana County.
Right.
Okay, Dan, thank you very much.
Okay, Mark, thank you.